Health this morning, we have joining us on set to look at the World Epilepsy Awareness Day, which was held on the 26th of March 2023. Right next to me from the Pediatric Neurology Department of UCTH, we have Dr. Torty Chimazie. Good morning.
Good morning.
Yes, and my other lady in the mix this morning, Dr. Vivien. Good morning.
Good morning, Professor Vivien.
All right, I hope you don't feel offended, ladies first right now. You're outnumbered by two. Dr. Vivien, let's look at epilepsy. What should we know about epilepsy? Because we have so many myths surrounding it.
Yeah, thank you very much. Epilepsy is one of the commonest neurological disorders that presents in the neurology units of every hospital. It's a disorder of the brain where there is abnormality in the neural cells. The abnormality affecting the neural cells, causing like a misfiring of the neurons. This now presents as seizures disorders.
Okay, so that's just it. Now, Dr. Torty, there are so many things people who suffer epilepsy should look out for. Like, how do you recognize it from your department? I know you deal with children. How do a parent recognize these things, symptoms in a child to realize that it's not witchcrafty or anything? The child might be having some epileptic conditions.
Yeah, thank you very much. Yeah, it's good to mention that epilepsy occurs across all ages, both in children and in adults. For a child, a mother notices, or a parent or a caregiver can obviously notice manifestations of epilepsy. And one of the commonest ways that we know, and what we call convulsion, is jerking of the body. Jerking of the body. But beyond that, it can manifest in other ways. It can manifest in the jerking of the whole body, the one we call generalized epilepsy, generalized tonic-clonic epilepsy. It can also manifest in jerking in one part of the body, or even a part of the face. It could manifest in a part of the body, like the face turning to one side with rolling up of the eyes. Sometimes in infants, the only thing you may notice is that the child's gaze is deviated, as if the child is gazing upwards, fixed gaze upwards. And the eyeballs roll up so that you're only seeing the white part of the eyes.
The body might or might not be shaking at that point.
The body might not be shaking at that point. It can also present in steady gaze. As you're just speaking with the person, you just notice that the person pauses, stares into space, and after a few seconds, the person returns to normal and continue the conversation or whatever he was doing at that point.
So it's not compulsory for the body to shake?
The body must not shake for it to be epilepsy. For some people, it might just be what we call a drop attack. The person is just doing whatever he's doing and all of a sudden drops on the floor. Yeah, but the commonest that we know, which of course too, in terms of the percentage in the population and what we see in the clinics, most of them come with the jerking type, the jerking of the whole body. But it's very important to note that any form of abnormal behavior you notice in a child or any person or an adult that you're not comfortable with, any form of abnormal movement, the child should be brought to the hospital so that the doctor will now take a good history, ask pertinent questions, sometimes may request the video of the occurrence as an evidence.
So it's important that video should be taken when this happens?
Very importantly. When you notice anything that is recurrent abnormal body movement of the body, record it before coming to the hospital.
But would that not be like time wasting? What should be done to help a person at that point, like some sort of first aid? Because growing up, I had a neighbor who had convulsions and spoon, we place spoon in their mouths to ensure the teeth don't lock and all of that. So what should we do and what shouldn't we do when someone is convulsing? Please, Dr. Vivien.
Okay. When you have a child convulsing or anybody, an adolescent convulsing, what you need to do is to make sure that the person lies down flat on the floor and you remove anything that can harm the child. So you remove all the harmful objects around, make sure that the child is just there on the floor, there's nothing around, because they will be checking movement and all that, there's nothing around the child that can injure the child. If the child is wearing any tight clothing, just remove it. Nothing should be choking the airway. So you release all the tight clothing and just allow the child the seizures, the convulsion to continue. Please do not put spoon. We see a lot of people doing that. Some people put palm oil, olive oil, all that are not necessary. They are shown not to be of no benefit. Sometimes in one cases I saw a mother rushing a child with burned foot. So some people go as far as burning the child's food. So we do not ascribe to all those things. All those help they complicate this thing. So just allow the child don't put the child on surfaces that can fall down, like bed or table and all that. The child will fall down and maybe hits the head or so. So that's why we say keep the child on the floor. Most seizures, especially in children, do not last more than 5 minutes. Just time it. It don't last more than 5 minutes. Before you know it is over. And then when the child is over, sometimes after the seizures, they tend to go into what we call postnatal sleep. So you just lie them on the left lateral side, because at that point they may be bringing out saliva and we don't want them choking. So just put them on the left lateral side where the saliva or whatever is coming out can just come out and fall on the ground. So you don't need to put spoon. All those have been shown to cause more harm than good. Because in the process of putting that spoon, the child is fitting, the child will bite the spoon. There's a lot of them that dislodge their tooth and even go as far as aspirating it. And that will even complicate the whole problem from just simple seizures. So just keep the child and make sure that everything around the child is free. And please, epilepsy is not communicable. So you see someone was just walking on the street and fall down and is jerking, and instead of people to rally around and assist, you see everybody running away. And people believe that once the saliva touch you, once you touch the patient, you become an epileptic. That's wrong. Epilepsy is not communicable. So at any point you find someone convulsing, please stop by and give the necessary first aid.
So which is removing their clothes,
remove the tight clothing, and because a lot of them when they fall down, they either hit their head or they are injured by sharp object or they end up in the gutter. You know, it might fall on the road, but because nobody is assisting, the person now have the convulsion and enter the gutter, hit the head and all that. So most times it's even the complications from the fall that is killing this patient, not necessarily the seizure itself.
So when they are jerking like that, it's just to give them space.
Just make sure that, yes, you give them space. Nothing around them will harm them.
You sure have been doing wrong things.
Yeah, a lot of misconceptions.
You said it's not communicable though, but Dr. Torty, is it hereditary?
Yes, but not at all times. Okay. There are a lot of causes of epilepsy, and about more than 70% of the cases, it's not genetic, it's not hereditary. It's just a small percentage. That's why sometimes when you make a diagnosis and tell somebody, or you diagnose a child of epilepsy, the parents will be asking, but we don't have it in our family. It mustn't necessarily run in the family. There are a lot of causes, and for children, we need to highlight some of these causes. When a child is born, you expect the child to cry, taking the first air, air enters the lungs, mixes with blood, circulates around the body, especially the brain. If a child, for one reason or the other, comes out not crying, what we call beta asphyxia, is a possible cause of epilepsy. Also, brain infections, meningitis, viral encephalitis, which are mostly preventable by immunization. If a child has any of these infections, one of the complications could be epilepsy in the long term. If somebody falls down, hits the head anywhere, head injury, and bleeds into the brain for any reason, even if a child has a tumor in the brain, or the ones that we cannot prevent, like malformations of the brain, for one reason or the other, they can come down with epilepsy.
Because I was going to ask if it's something that is preventable.
Yes. The preventable part of it is making sure that you deliver in an environment or in a facility where the labor is supervised, such that if there's any need to intervene to ensure that the baby comes out fine, crying, it should be done. So things like obstructed labor, prolonged labor, delivering in places in traditional birth attendants that are not trained. We live with them, so what we do is to train and retrain them so that we're able to identify when there is need to refer. But the safest thing would be attend antenatal care in a health facility and deliver in a health facility, such that the baby comes out fine. Then, immunization. Immunization against the common causes of meningitis, like pneumococcus, Haemophilus influenza, and Neisseria meningitis. We have specific vaccines for them, and all of them are in our routine schedule of immunization.
Because I don't know if most of us took it while growing up. I don't really added.
No, they've been there.
So this week we realize it's a week you spend on sensitizing people on epilepsy awareness. How have your schedule of activities been so far, Dr. Vivien?
Okay, we are meant to start on the 26th. On the 27th with the TV, but we had some job.
Yeah.
So on the 27th we visited Main Avenue, Primary Health Center, Main Avenue, where we were able to sensitize the mothers and the health workers. We gave them talk on epilepsy, what to do and what not to do, what to believe and what not to believe. So we discussed a lot about the myths around epilepsy, and we told them what to do when a child is convulsing at home, the necessary first aid you must give before bringing the child to the hospital. We also enlightened the health workers there on what to do when these children are brought to them. So it was really nice. They were very happy. It was quite educative, and everyone went to learn something.
Right. Yeah, just something just occurred to me now. Some people are physically okay, but they have epileptic, they are suffering from epilepsy. Some could be obvious from maybe a shivered hand, or both hands are shivered, and it's obvious that this person has this. I don't know, does it come with malforming a part of a child's body, or I don't know, those are just casualties from convulsions or all of that?
A child that has epilepsy, you will not know until you're told.
So how do they end up with shivered hands?
What happens is that those that have physical disabilities have things like cerebral palsy, of which epilepsy could be a component, but not all of them will have epilepsy. But for those who have only epilepsy, a lot of people have epilepsy, but you don't know.
Especially when they're on drugs.
Doctors, all professionals, it doesn't limit you from achieving what you want to achieve. So the key word is getting the right diagnosis, starting the right treatment. If you take your medications regularly, go on your follow-up regularly on your follow-up clinics, the ideal aim is to achieve control, so that while on drugs, the person is no longer convulsing.
That's what I want to ask. Can it be treated? Like, can you be healed from epilepsy?
Okay, basically, epilepsy can be treated, but not cured. So when you come to us, we start you on your, different epilepsy have their different treatments. So when you come to us, based on the type you are presenting with, we'll start the medication for that particular type of epilepsy. And then once you start your medication and you're able to attain the serum concentration of that drug, you're able to control the seizures. And so you will be seizure free and keep taking your drugs. But we stop the medication when you have been on the drug and you have been seizure free for at least 2 years. So we will now say it's treated, but it's not curable, because 22 to 75% of them have a chance of reoccurrence. So what we do is we stop the medication, but we keep you on follow-up. So we can say come 3 monthly, 6 monthly. We still follow them up to be sure that everything, yes, you don't have a recurrence. Yes.
Before we let you go this morning, Dr. Torty, let's have your message to everybody watching us at this time or listening to us at this time on a day, or rather a week like this?
Yes, this epilepsy awareness, we are here to sensitize the public and to tell them that do not stigmatize against those with epilepsy. Children with epilepsy should be in school. They should not be at home. They should not be locked in the room or not exposing them to the public. They have the potential to achieve whatever they can achieve. So long as the child is brought to the hospital and started on medications, it can be controlled. Then, when you see a patient convulsing, this patient needs help, this person needs help, do not run away. The saliva or whatever comes out from the person's mouth, even if it touches you, nothing will happen to you. Even if the blood touches your hand, nothing will happen to you. Let's not stigmatize them. They will need help when they are convulsing. That's why we are here, to tell everybody that it is easy to care for them. Do not put anything in the mouth. Do not put anything into their eyes. Do not burn any part of their body. Just allow the person. He finishes within 5 minutes. But if he continues beyond 5 minutes, carry the child to the hospital. Thank you very much.
Thank you, Dr. Vivien, to your message to mothers out there.
Yeah, my message is basically to address some of the myths. There are lots of myths out there about epilepsy. Number one, yeah, it's communicable. Dr. Torty have already told us it's not communicable. So when next you see a child convulsing, an adult or anyone convulsing, please stop by and help. Then number two, this belief of putting spoon, onions, pepper, olive oil, and all sorts of oil have shown no benefits. So please, when the child convulses, do not introduce those harmful objects into the child. Then number three, I want to talk about the belief that herbal concussion, urine from pregnant women, all those things have not been found to cure epilepsy. Then epilepsy, though it runs in some family, but it's just a small percentage. So don't be scared to marry from that family. If you hear that they have epilepsy, please go ahead and marry them. Then it does not affect intelligence. So every child, everybody that has epilepsy should be allowed to go to school and attain whatever professional desire that they want to. In fact, from experience, most of the epileptic we have seen are very, very intelligent. So I want to reach out to everybody out there, crossivarians. Epilepsy is treatable, though not curable, but you can always attain your goals, even if you are an epileptic. So thank you very much. Make sure that out there you spread the good news, be an ambassador. And when next you see an epileptic, please don't run away from them. Thank you.
Thank you so much, Dr. Vivien Otu and Dr. Torty Chimazie, both of the Pediatric Neurology under the Department of Pediatrics in the University of Calabar Teaching Hospital. We hope to have you here, more often to talk about things like this and more.
It's our pleasure.
Thank you very much. Thank you, Cross River.
Stay with us. Good Morning Cross River Wednesday edition continues in a bit.